think it could be so beneficial, and I feel like it's such it feels at the minute from a nurse's perspective to be quite a small cog in everything, where it could be utilised to be something big and major that we could take forward in the future.
So as a GP, I've been really keen and really involved with the Great North Care Record for many years. I am a GP in Gateshead, just right on the Tyne, and have patients that use Newcastle hospitals, Gateshead hospitals, the Foundation Trust providing our mental health, CNTW, and many different organisations. And it's quite complicated when our complex patients are being seen by multiple places, and being able to see the consultations, for example, in our mental health trust, is so invaluable as a GP, because often we will see them the day after they've been seen in another organisation, and there isn't enough time often for discharge letters to have been written or outpatient letters to have been written, and be able to just log on and see what happened yesterday transforms the way I can care for my patients.
But I think it is something that we can really exploit in the future to make it even more of a tool for people of Hartlepool and the wider region.
North Care Record has been an absolute game changer in linking up the world of maternity and neonatal with the rest of healthcare. We think we're very important in maternity, and we obviously it's the start of everyone's life, but we are a very short amount of time, and it's important that the care that we give can be seen elsewhere. So being able to start making that link has been really transformative for us.
Is vital to safe delivery of drugs and pharmacy. The allergies that we can see within the Great North Care Record is really useful, and the extended labs set that we can see from neighbouring trusts really helps the care of patients day to day.
We should always think from the patient's perspective. It feels really unfair for our distressed patients in really difficult situations to have to tell their story more than once. If they've told it to the NHS, they expect us just to be connected.
It's vital that anybody dealing with care and support gets the full picture of what a person's situation is, and that's not just social care, it's not just health care, but it's everything. It's GPs, hospitals, etc. So to get all that picture in one is fantastic. It's exactly what it should be.
Data and the information that we need about the people that we care for. I think it's very well known at the minute. Maternity care is a particularly hard place to work, and it's complex, and we're seeing a real change in the women and the pregnant people that we care for. Being able to access that information quickly and easily makes such a difference when you're not battling with IT systems and different logins, to be able to find out what you need to just be able to deliver the care. And I think that's why it's so important for the clinical staff on the shop floor.
Badgernet at the moment, which is due to deliver early next year for us, and to bring that into the Great North Care Record will be invaluable to maintain our existing position and make sure that view of the regional maternity services is available to clinicians.
Maternity is not the extent of all the services that a woman will need during her pregnancy, because she may come to us with diabetes or cardiac problems, and she has other specialists involved. And being able to link that information will mean that we can share that way more easily, and I think it will really help sort of start to improve the care that we give and how streamlined it is.